And I want to categorically state that no hotel, no matter how large or small, is an authority on testing, nor should they be making comments. It's unfortunate. Should they be making comments on the accuracy of Grenada Ministry of Health, CARFA, Pan American Health, or St. George's University's ability to accurately test?
That was Health Minister Nickolas Steele responding to a press release issued by Sandals Resort on Wednesday, which sought to provide an update on the team members and guests who were recently tested and retested for COVID-19 as part of the cluster. The statement said in part, and I quote, "Of the 11 Sandals guests identified as being positive, they were also retested immediately upon their return to the United States from Grenada, and 9 have received negative results." During a press conference on Thursday, the health minister described the move as unfortunate.
And I have read that release as well, and I see no reference and no information given to the authority from which they speak, which public health authority they now have or have acquired in order to make such public statements. So I would say that those statements are unfortunate. We have worked with the employees and local team here of Sandals and look forward to continuing to work with them to get to the end of this. And I think the one way that this can be accomplished is by making sure that we deal with the facts, we deal with the situation at hand, and we not try to discredit each other. We will maintain our policy here of dealing with the virus, the outbreak, and those affected by the accurate testing of them. And we expect all involved to also do the same.
Sandals' statement added that the 9 individuals had both PCR and antigen tests, which confirmed they do not have or ever had any trace of the virus in their system. The release also stated that based on the second round of testing which was conducted by the Ministry of Health on December 23rd, the results for all 432 team members have returned negative PCR test results. Acting Chief Medical Officer Dr. Sean Charles explained the difference between a PCR and antigen tests.
The gold standard test is the RT-PCR test, and that is the one that we currently do at our lab. All right, that is the RT-PCR test. The RT-PCR test identifies nucleic acid of the virus. All right, the nucleic acids are present. The viruses have to be there for their nucleic acids to be present. There are other tests, such as antigen tests, that identify some proteins that are produced as a result of infection. They are not as sensitive as the RT-PCR test, but they are accepted. There are many countries that have emergency use authorization for these tests. So
the CMO said there is a small window between 1 to 5 days following infection when the antigen test can be beneficial in identifying individuals who are infected. He added that with persons who are asymptomatic, the usefulness of the antigen test is less useful. Christina John, GBN News.